factor into your travel plans. I'm going to now introduce our next speaker before I hand over to Noel to chair the rest of this session. A real treat for me. Delighted that in recent months she was quite rightly given back the health spokesmanship. She really is one of the true troopers of our party. She has contributed both in terms of money and time for years. She deserves everything that she gets from this party. Please show her your appreciation. Our health spokesman, Julia Reid.
Just realised I've got my speech upside down. Good afternoon, ladies and gentlemen. This is my first speech at conference since becoming UKIP's health spokesman in July, and I hope that I will prove to be as able as the most recent incumbents, Louise Bors and Suzanne Evans. Under their guidance, UKIP's health policy for the 2015 and 2017 general elections were extremely good, and I plan to use their previous contributions as a strong foundation for the future. Before I begin my speech, I wish to reiterate that despite what members of the Labour Party have said, UKIP have no plans to privatise the National Health Service. Which is a national treasure and an institution that we hold close to our hearts, and one that makes us proud to be British. The majority of us have been born into it, and over the last 7 decades, we will have all benefited from it in one way or another. And many of us, such as myself, would not be here today if it wasn't for the National Health Service. Even so, there are issues that need to be addressed, one of which is funding. According to the King's Fund, there are approximately 240 NHS trusts and foundation trusts providing NHS ambulance, hospital, community and mental health services in England. As recently as 2010-11, only 5% of these providers had overspent their annual budgets, but the most recent figures for 2016-17 show that 51% of all trusts are planning to end the year in deficit, with almost 75% of these being trusts that are acute hospitals. 4 years ago, NHS providers recorded an aggregate surplus of almost 600 million, but since then, provider finances have deteriorated so that an overall deficit of 2.5 billion was recorded in 2015-16. Part of this deficit is due to private finance initiatives, more widely known as PFIs, introduced by the Conservatives in 1922, but expanded when Labour came to power in 1977. They are now estimated to cost the National Health Service £2 billion a year. Using the official Treasury database of PFI schemes and the accounts of the PFI companies held by Companies House, a report published last month by the think tank Centre for Health and the Public Interest found that between 2010 and 2015, the NHS and other local authorities in England spent £10.7 billion on hospitals and other healthcare facilities built through PFI schemes. Currently, the Department of Health oversees 125 PFI contracts with private companies, the capital assets of which total £12.4 billion, for which the NHS will pay approximately £81 billion over the lifetime of the schemes, typically 25 to 30 years. Basing part of their study on the 110 PFI contracts for which the full data was available, the CHPI found that over the past 6 years, PFI companies holding NHS hospital contracts have made around 831 million in pre-tax profit, equivalent to a post-tax profit of 680 million. According to the CPI, and I quote, This profit is in addition to the profits made by the banks on the loans they have made for the building work, by the construction companies which built the hospitals, and by the companies which provide maintenance and other services for the hospital buildings. In their report, the CHPI suggests that the NHS is leaking money to private companies, some of which could have been spent on patients. In their opinion, the profits made by some PFIs appear to be excessive and recommend that the amount of profit which can be made by a private company which has an exclusive public sector contract with the NHS should be capped. Clearly, this is a situation that needs to be addressed, and it is only UKIP that has to date put forward a fully costed plan for funding the NHS by utilising savings from the foreign aid budget. UKIP will also end the use of PFI contracts within the NHS and seek ways in which funding can be found in order to buy out those PFI contracts currently in force, where financially viable to do so. As an aside, if previous UK governments hadn't been committed to sending money to Brussels for membership of the EU, would they have been able to afford to build hospitals themselves rather than having to resort to PFI contracts? Those of you who heard our own Helen Hims on Question Time last week, when she said, according to ONS figures, we've paid 503 billion into the EU since 1973, isn't that enough? Probably think they could. And another serious issue currently blighting the NHS is the staffing crisis. Over the last year, staff vacancies within the NHS have risen by more than 10%, leaving tens of thousands of posts unfilled. And according to figures released by NHS Digital, more than 86,000 NHS posts were vacant in the first quarter of this year, an increase of almost 8,000 when compared to the same period last year. Many of these vacancies are for frontline staff such as nurses and midwives. Figures released by the Royal College of Nursing show that there is a shortage of around 40,000 nurses in England, and according to the Royal College of Midwives, our maternity service are reaching crisis point with a shortage of 3,500 midwives in NHS England. Even more worrying is the report published in July by the Nursing and Midwifery Council, which found that for the first time in recent history, more midwives and nurses are leaving the profession than joining it. Between 2016 and 2017, 45% more UK registrants left the register than joined it for the first time. And although there have been fewer EU nurses and midwives joining the register since the EU referendum, the recent figures showed that the downward trend was more pronounced for UK nurses and midwives, who make up about 85% of the register. The NMC data also appeared to show an increase in the number of nurses and midwives leaving the profession before retirement age, most notably among those below the age of 40. Prior to the report, the NMC had conducted a survey of 4,544 nurses and midwives who had left the register over the preceding 12 months. Excluding those who had left due to retirement, 44% said they had left because working conditions, such as staffing levels and workload. 28% said it was due to a change in their personal circumstances, such as ill health or childcare responsibilities. And 27% said they were disillusioned with the quality of care provided for patients. These findings are extremely serious, and the situation has no doubt been exacerbated by the government's 1% cap on the annual pay rises for NHS workers. Recently, Janet Davies, the Chief Executive and General Secretary of the Royal College of Nursing, said that nursing pay has fallen by 14% in real terms since 2010 and is now worth about $3,000 each year. It is surprising that under such circumstances, Is it surprising that under such circumstances, some nurses are leaving the NHS to become agency nurses, where they can earn up to 4 times more than their NHS salary? So how have we ended up with this crisis in the nursing and midwifery profession? The answer is that successive governments have failed to plan ahead and fund sufficient training places for nurses and midwives, cutting them instead. Even though the NHS is becoming an increasingly less attractive place to work, we're still very fortunate to have tens of thousands of potential students applying for courses in nursing, midwifery, and other healthcare subjects. However, despite the recruitment crisis, every year approximately 2/3 of potential students are turned away due to a lack of available training places. Considering the shortfall of nurses that we have now and will have in the near future, the government's decision to abolish the NHS bursaries this year, which has seen applications to nursing and midwifery courses at British universities fall by 19%, seems misguided, especially as the extra 10,000 training places for nurses to be funded by the money saved by scrapping the bursaries won't be available till 2020. So what would UKIP do under these circumstances? Should we be elected, a UKIP government would increase the number of nurse training places, reinstate funding bursaries for nursing, midwifery and allied health professionals, tuition and accommodation costs. We would also make it easier for qualified nurses who have taken career breaks to rejoin the profession and cover the cost of their retraining. Similarly, UKIP would make it easier for those qualified nurses living in the UK from Commonwealth countries such as Australia and New Zealand to gain employment in the NHS. Unlike nurses recruited by NHS trusts who have been headhunted in India and the Philippines, where most of the testing is carried out before they arrive in the UK and who can be sponsored for a 5-year visa, nurses arriving from Australia and New Zealand do so on a standard 2-year working visa. These find the mechanism of registering as a nurse in the UK can cost more than £3,000 and take up to a year because the process can be overly demanding and slow due to what they consider to be unnecessary red tape. Part of the test involves a compulsory English language test, which surely is unnecessary for a native English speaker. In addition to bringing back the bursaries, UKIP will ensure that students on healthcare courses receive a living wage whilst they're on placements. What some of you may not know is that student nurses and other student healthcare professionals are required to work around 37.5 hours a week whilst on placement and are often seen as free labour. Unison, the union that raised this issue, pointed out that unlike typical students, the 37.5-hour-week placements, which healthcare students are required to do, make it difficult for them to take up part-time jobs to help pay their rent and other expenses. Often this results in them finding themselves in a great deal of financial difficulty and, through no fault of their own, can leave them completely maxed out on their credit cards by the end of their course. According to the results of a YouGov survey conducted last year, 71% of respondents and 72% of UKIP supporters feel that students should be paid for the time they spend working in hospitals. As with some training courses where students are paid, we would require that those students going through university with financial assistance work in the NHS for a number of years after qualifying. In addition to supporting our nurses and other healthcare degree students, we must also open our other paths into the profession for those who are less academically inclined. Consequently, we will bring back the state-enrolled nurse with an emphasis on workplace training. Such nurses used to make up part of the backbone of the nursing profession. Sadly, they're equivalent today who have a vocation to be a nurse, but find it difficult to pass the exams required for university are unable to enter the profession. We will also help and encourage those experienced healthcare assistants currently working in the NHS who wish to retrain as registered nurses by supporting them financially so they don't need to take a pay cut during the 3-year training period. Unfortunately, nursing isn't the only area where the NHS is finding it difficult to recruit and retain staff. According to the findings from a recent survey of 860 GP surgeries, there has been a 6-fold rise in vacancies for family doctors since 2011, with a staggering 12% of positions now vacant, roughly 1 in 8. A recent study conducted by the King's Fund, published in June this year, found that GP workload had grown both in volume and complexity, with their sample cohort experiencing a 15% increase in the number of consultations between 2010-11 and 2014-15. There are a number of reasons why this is happening, one of which is an increase in the number of patients registering at a GP surgery, with figures from NHS Digital showing that the number of patients registering with GPs had risen by more than 2 million in the past 4 years. This situation has been exacerbated as record numbers of GP practices closed last year, in spite of the government trying to stop local doctors shutting their doors, forcing 265,000 patients to re-register with another doctor. Pressures such as these are causing the reduction in the recruitment and the retention of GPs. Although the government has pledged to increase the number of GPs by 5,000 by 2020-2021, the numbers of those taking early retirement, moving from full to part-time, or working as locums, threatens to lessen the hoped-for impact of these new doctors. Despite this current shortage of doctors, almost 800 straight-A students are turned away from medical school every year. UKIP will lift the cap on medical school training places from 7,500 to 10,000 and ensure that all suitable Grade A students will find a place. In addition, UKIP will cover the cost of all medical student tuition fees, provided they commit to working within the NHS for at least 10 out of the 15 years after they qualify. Another area where the NHS is finding problems in recruitment is in the ambulance service. Figures show that there is a widespread shortage of paramedics, approximately 1 in 14 paramedic posts being vacant, resulting in a shortage of ambulance crews being available. As a result, NHS has been spending almost 80 million a year on hiring private ambulances to answer 999 calls to supplement their own service. So how does the scale of staffing crisis affect the ability of the NHS to provide treatment for those who require it? Last winter, the staffing crisis was so bad that we saw accident and emergency patients lined up on trolleys for hours on end. And unfortunately, this was not a one-off. Research from the Royal College of Emergency Medicine has shown that only 74% of accident and emergency patients at the 60 trusts they monitor were seen within 4 hours, against a 95% target, which means that over a quarter of accident and emergency patients are waiting 4 hours or more to be seen. The shortage of GPs across the country has led to ever-increasing waiting times for appointments, and over the last 3 years, the number of patients waiting at least a week to see a doctor has risen from 13.8% to 19%, almost a fifth of patients. Owing to the staffing crisis, the NHS has also had to rely on agency staff to supplement its own workforce, adding to staffing costs. Although some effort has been made to reduce spending on agency shifts, even so, in the last quarter alone, the overall spending on agency shifts still totaled 169 million, money which could have been spent elsewhere. On the plus side, we are fortunate that we have medical professionals across the world who are prepared to come and work in the NHS. Without their commitment to the NHS, we would definitely struggle. As UKIP's health spokesman, I would like to take this opportunity to thank them and say that after Brexit, a UKIP government would ensure that their jobs would remain safe and we would continue to recruit skilled health workers from abroad as and when they are required. Finally, as you can appreciate, the NHS, which will celebrate its 70th anniversary next year, is in dire need of some TLC itself in order to address its staffing problems, something which recent UK governments have been struggling to achieve. I would suggest, after Brexit, a UKIP government would be better placed to solve the NHS's financial shortfall and thus address many, if not all, the staffing crises. In order to enable us to do this, I would ask people to put their faith in us and vote UKIP at the next general election. Give us the opportunity to make the NHS better. Thank you.